Hello, and welcome to the COVID Advocacy Exchange. I'm Dave Fuehrer, CEO of Gryt Health and a two-time cancer survivor. I'm honored to be with you today and to welcome you to the COVID Advocacy Exchange. Before we get into this conversation today and share more of what's coming up, I'd like to take a moment to honor what we're each dealing with. Wherever you are in the world, or whatever your organization is focused on, we are all dealing with the effect of COVID on our lives. I'd like to take a moment to please have a moment of silence for everyone around the world and everything we're dealing with. Thank you. We're really excited for the panelists and the conversation that we're about to have going into today's session. This is meant to be an interactive conversation, and we encourage you to be a part of this at any time, whether through the chat bar at the bottom of the screen or through the Q&A function that sends us and the panelists questions directly. Please feel free to open the chat bar now and share with us where you are in the world so we can see where everybody is connecting from. Thank you. I'd like to start by sharing my gratitude for all of the individuals and organizations who are making this possible. I'd like to thank Bristol Myers Squibb for being our supporting partner to bring us together, to uniting advocacy organizations, and to making this collaboration possible. I'd like to thank the team at Evoke Kind. They are a passionate and dedicated group of humans who care about improving and saving lives. And I'd like to thank my team with Gryt and for their grit. They are the ones who make each of this and all of the work that we do for our community possible. Thank you to everyone for all of the incredible dedication. And I'd like to thank you for spending time with us today, for being a part of this global health conversation, and for finding ways to not only get through COVID, but to become better because of COVID. I've been on what I consider a listening tour for the last several weeks. I've gotten to talk with the leaders from 60 different advocacy organizations around the world and in many different therapeutic areas. And although many of us are dealing with different or unique challenges, we are all being challenged. I've heard really three similar things in each of these conversations and from all of the advocacy leaders that I've spoken with. The first is how COVID is interrupting the world we thought we were managing. There's fear, there's uncertainty, there are questions from our community that we are all racing to address. The second common theme is how we continue to fulfill our missions, our promise to the individuals and to healthcare that are the reasons we are advocates. They are our core purpose, and we are all so dedicated to not losing sight of how we continue moving those forward despite all these challenges. And the third area that I hear from all these different conversations is how we all want to get better, not just get through COVID. How the work that we're doing and these collaborations can make improvements. It is the reason that we are forming this COVID Advocacy Exchange. It is the reason we are together. I heard one of my mentors say in the last week that COVID is turning walls into bridges, and we hope that our time together is one of those bridges for you. This is a patient-led and patient-driven initiative, and I am so honored and grateful for all of the work that's gone into it already. I'll share with you in just a second before the panel more of this virtual conference site. There is an exhibitor area where you can feel free to check out the different resources from different organizations. Let me share my screen now so you can see what that looks like. So this is where we are today in the lobby. Anytime you're in the live session, you can click this purple bar at top and navigate each of these session areas. By leaving this lobby area and going into the exhibitor hall, you can visit all of the booths that are set up by the different advocacy organizations. Pat from the Max Foundation is on our panel today and one of the first booths that you'll see. These are all interactive. You can click on them anytime and go directly to the resources and information they have available for us. Please feel free to visit the information desk anytime. Leave us questions, make comments. We'd love to hear your feedback. Thank you. Okay, so let's get into the first panel. Last week, we launched this advocacy exchange. It was a really powerful conversation about why coming together, why exchanging informations, and why getting through COVID is so important. Today, we're building on that same topic. Today, our focus is about coalitions and collaborations. The individuals that you'll meet in just a moment are legends, and they are heroes of mine. They have spent their career using collaboration to solve some of our biggest challenges. I'm going to have them introduce themselves and spend a few moments talking about the work that they do, why they do it, and also, if I may ask them to share who is a mentor that's helped them become the advocates that they are. I won't be able to do them justice, so I will turn it over quickly to Cary to introduce himself first. Cary, please say hi to everybody and share the work that you do. Thank you.
Thanks very much, Dave. So Cary Adams, and I'm the CEO of the Union for International Cancer Control, based in Geneva. Many cancer organizations will know us because we're a membership organization. We have 1,200 organizations who are members in 173 countries. And we basically do three things for our membership. One is the advocacy, which is working with the United Nations, the World Health Organization, and others to make sure that cancer and the other NCDs, non-communicable diseases, stay on the global health and development agenda. We do a lot of convening, not too much this year because of COVID, but I'll talk about that later, about how we're converting our organization from being face-to-face to being virtual. And we also do capacity building, which is helping our members around the world to improve the work that they do, often in support of patients directly, which is something that we don't do. And so those are the three areas that we work in. And my career's been interesting. Well, it's been interesting for me because I did 23 years in banking, and then I've done 10 years, nearly 11 years in global health. And you talk about mentors, and I think most of the most influential mentors that we come across are probably when we're younger. And I was blessed to work with some fantastic business leaders during my 20s and 30s who shaped my thinking about how to have an impact and leverage assets so that you can make a business improve, grow, develop, achieve the ambition of what the clients or customers want. And a lot of that learning and teaching from my business background has made me behave in a way with my own organization and other organizations about focus on the problem, focus on the solution, and then create partnerships, create innovative ways that we can collectively address those issues in a sustainable way in the longer term. So I will name one person, a guy named David Weidenbach, and you can ask me about him later. He was my boss many, many years ago, but so many things that he said to me resonate in today's world, and he was a banker.
You've got me intrigued, Cary. I can't wait to hear more about that later. Thank you so much. I'm honored to introduce our next panelist, who is Pat from the Max Foundation. Please say hello to everyone, Pat. Thank you.
Good morning from Seattle to everyone. My name is Pat Garcia-Gonzalez. I'm the head of the Max Foundation. And, you know, our work is specific to increasing access to treatment, care, and support for people living with cancer in low and middle income countries. So we do something, we believe that in cancer, there's many challenges that we have. And of course, now we have more challenges to make sure that every single cancer patient can have access to treatment no matter where they live. And the one thing that we have become really experts in is in actually bringing access to treatment to individual patients. So we have a big program, Max Access Solutions, and we are supporting and bringing cancer treatment to about 30,000 patients right now in 70 countries, working with about 200 hospitals around the world. So that's a sort of a big operating program of the Max Foundation. And in parallel to that, in the past 20 years, and as we have brought access to treatment to patients, we have partnered with many patient leaders that have come to us and said, you know, you helped me now I need to change my life and I want to give back to my community. And so we started supporting these individuals to develop and form and register patient organizations in their countries. So in parallel to sort of the big network that we have of access to treatment, we have this network of patient organizations that we partner with and support. And when you ask me about a mentor, I think of a young man in Sudan who I met in 2012, and his name is Hisham. And when he introduced himself to me, you know, he had been on treatment for cancer for 2 years. He was 34 years old. He was married, had 2 little girls. And he told me that when he was first diagnosed with the cancer that he had, and he was told the treatment that he needed, he sold his house to buy the first month of treatment that he needed, only to find out that of course he needed treatment for much longer than that. And somehow he got connected with us and we had been able to help him have access to treatment. But the thing about Hisham was that he has since then dedicated the rest of his life to give back to his community. And he was doing all sorts of amazing volunteer work in Sudan. He had formed a patient organization and he was doing all this work with the children's hospital and all that. So to me, I feel so grateful that I have met so many remarkable people in these past 20 years who have so little and give everything. And they have taught me the true meaning of generosity. And so it's the Hisham in Sudan and Sylvia in Guatemala and Baisha in Morocco. And I can stand hundreds of really amazing community leaders that have taught me what is the real meaning of giving back and advocacy.
That makes my heart smile, Pat. There's been so many people in my life that have made me who I am. And I think we're all on that journey, right? We're either newer to advocacy. I've looked up to both you and Cary for most of my career for what you do in cancer advocacy. And so to be on that spectrum with you is an honor. And a new friend that I'm really excited to introduce next is Trudie with the Arrhythmia Alliance, and getting to collaborate with individuals outside of cancer, which is where I've spent most of my advocacy work, has really opened up my perspective and my understanding. And so Trudie, some of the conversations that we've had over the last few weeks have been really inspiring and eye-opening. And so I'm honored to introduce you and welcome you to the conversation.
I'm not sure if you can hear me. The video is the internet. Can you hear? Oh, good. Thank you. Thank you for including me. I represent a heart rhythm organization, although I'm also a cancer survivor currently in remission. So wearing 2 hats, but my work, my passion, my commitment is with arrhythmias, heart rhythm disorders. I started a non-profit 27 years ago when my daughter, who was only 3 at the time, was diagnosed with a rare heart rhythm disorder. She now heads up our US chapter. And my husband died 12 years ago from sudden cardiac arrest due to an arrhythmia, both the most common arrhythmia, atrial fibrillation. So people say, what drives me? My daughter, my husband, my parents. We offer information, support, education, and awareness. It took over 3 years to find out why my daughter was losing consciousness up to 8 times a day and nobody could give me an answer. And I'm the sort of person, tell me the worst and I'll go from there. And that's just the way I am. My mother's the complete opposite. She doesn't want to know. I needed to know. I couldn't deal with the unknown. So hunting out what was wrong, traveling around the UK, it was before the internet, contacting people by writing letters, willing to go to America, Australia, but it turned out the world expert was in Scotland. So I'd say my mentor was Professor John Stevenson, who unique, he's a neurologist, but he was interested in cardiology. And he was able to tell me, despite seeing lots of cardiologists, he was able to diagnose my daughter. But he didn't have any treatment. And that day he asked if I would start a small patient support group, maybe 10 patients or families a year. He's retired now, and he still apologizes because we've dealt with millions of families over the years, but he's always been there for me. So he's my mentor. There have been lots of doctors, healthcare professionals, because always that day, March the 23rd, 1993, I said to him I would start a group as long as I could always turn to him for information support and to ensure that I was delivering accurate information. I needed someone to work with me, to collaborate. Little did I know that day, snowing in Scotland, that was the very first collaboration. Fast forward to 2003, where arrhythmia services were poor in the UK. I ended up, through a letter campaign, changing government policy, being the first non-medic to sit on the expert writing group. And that's when I got it in my head. There are lots of groups, just like there are lots of cancer groups. If we work together, we can bring about change. We don't lose identity. We still own our piece of whatever that is, but together we contribute, we bring about change. And so the first awareness week that I organised by 2004, I announced the launch of Arrhythmia Alliance. By coincidence, our World Heart Rhythm Week is next week because we're now across the world. And 3 years after that, in 2007, I launched the AF Association. So I run 3 organisations. They're all arrhythmias, but when you're diagnosed, just like you have numerous cancer organisations, because people want to be able to contact the sick cancers, it's the same within arrhythmias. But Arrhythmia Alliance is a collaboration of patients, carers, patient groups, healthcare professionals, policymakers, industry, all those affected by or involved in cardiac arrhythmias, and collaboration is key. So my mentor and my family, Professor John Stevenson, other cardiologists, John Cam, Adam Fitzpatrick, that have helped me on my way and have always lent their support and guidance. My background, I worked for a bank, I taught ballet, and I was a stay-at-home mom.
Thank you, Trudie. We're honored to have you with us. I'm honored to be a collaborator with you. And it strikes me in all of these conversations how much a diagnosis can turn our world upside down. And whether we're a patient being diagnosed or someone who loves the patient or a researcher studying a new field. I'm a researcher by training, and my purpose is to advance research and care for patients by including the patient voice in everything we do. And regardless of what our specific focus is, disease and diagnosis can turn that world upside down. And Cary, you know, it really, I feel it, how much COVID has done that to us now, and how much many of the things that we were doing and thought were going well and problems we were solving have really been impacted significantly. And it's important not to just try to be overly positive about them, but to acknowledge how much they're really impacting us and the communities we care about. Some of the things you shared that your organization has been able to mobilize so quickly are really impressive. So can you share with us, how do you see COVID affecting advocacy and healthcare in general, and what are those things you're doing to address it?
Yeah, sure, Dave. And can I just say, Trudie and Pat's stories are inspirational themselves. So I hope there are people out there listening to those stories and being inspired about getting involved in global health and cancer specifically. Can I just talk about my journey into cancer? Is quite interesting. I'm not a cancer survivor. I've lost friends and family to cancer, but when I left the banking industry, I knew I wanted to do a job rather like Pat or Trudie or you, but I didn't know quite what to do. And then a headhunter sent me the job description, and it was a 2-page description of the CEO for UICC. And I read it, and by the time I'd finished the 2nd page, I had actually a heart problem, Trudie, because my heart was pounding. But I thought, this is the job I want. You know, I just wanted that job. And I remember talking to the headhunter, who was a wonderful guy. And I said to him, I sent him an email saying, I really love this job, John. When are the interviews taking place? And he wrote back to me, he said, they're taking place in 2 months' time, but you've got no chance. And that was his response. So I wrote back to him and said, I've got 2 months, give me a chance. Get me on that interview list. And he got me in, and I was the only person not involved in health who got the job because of an inspired board. So talking about mentors and others, I think there's a group of individuals who are inspired to take a risk with someone. And I wouldn't be here today without a board of directors that said, we've got a great panel of people being interviewed for this great job, but we're going to take a risk with a banker. And they took that risk, and I'm indebted to them. So I think there's a learning point there for all of us. Now, you can be a mentor, but at the same time, you've got to have that, you've got to spot those opportunities to promote, as Pat did, the incredible people are out there and give them a platform to be successful and to bring value. So I just wanted to build on that, because I think that's an important part of our roles as leaders around the world, that there are brilliant young people that we can inspire ourselves and take them to that next level and give them a platform. In answer to your specific question, I think we recognized pretty quickly in UITC, and particularly our board and the management team, that COVID was going to change the dynamic completely this year and potentially next year and the year after. And it was important for UITC to recognize that it was going to impact severely our members around the world, all of those cancer organizations that try every single day to have an impact on cancer control in their own country or their city or their state. And so we just re-engineered our whole business literally over 2 weeks. And we said that we're going to stop all face-to-face meetings, because we're, as a global health organization, we couldn't encourage international travel, and we shouldn't be encouraging people getting together. So we stopped it all for 2020. And then we set a task for our team to say, how do we achieve our ambitions, both in advocacy but in capacity building, by embracing the technology that's available and using it in ways that we've never used it before to reach out to our community in a way which is impactful for them. And I'm blessed with a fantastic group of people around me who are innovative, entrepreneurial, and they can get things changed quickly. So we really did shift the whole of our business model over to virtual. And if you go to the UIC website, you'll see all of these virtual dialogues are coming out week after week after week on subjects that are important to our members. Subjects, for example, digital fundraising. Why is UIC doing digital fundraising? Because nearly every cancer organization in the world is currently starved of cash, because they can't do their runs, their walks, their cycle rides, their gala dinners and things like that, which we know patient groups desperately need those funds to do the work they do. So we've got a dialogue coming up on digital fundraising. I'm sure that's going to be really popular, because that is the demand of the moment. Now, we'll probably talk later about the longer term implications, but I would suggest that any organization that's waiting for COVID to go and things will get back to the it was will probably suffer more than those who accept that the world has changed already. And as an organization which is about working with and through others, we've got to adopt our processes, adopt our products and our services to meet the requirements of those on the front line. So for NGOs like myself, we're not on the front line. Pat is, and it sounds like Trudie is, or her members are, but we've got to adapt to support them to face up to the realities of a COVID world where cancer patients are definitely struggling at the moment and potentially will struggle in the future. So there are some important things to think through at the moment.
Yeah, powerful, Cary. The session that we're having next Thursday is actually around how to do virtual conferences and best practices. And as so many of our advocacy groups try to move into a virtual world, if we don't have experience, how do we do that? And not just do that to disseminate information, but to also the connection and reduce isolation, and the things we depend on as advocates are such an important part of that. So we'd be honored to share any of that information in the next session as well. Thank you. Pat, I know that so much of your mission is focused on underserved individuals and underserved areas. And I have to imagine that when you're dealing with that set of challenges already, having COVID laid on top of that has got to present some real challenges. What are those for your organization, and how are you dealing with them?
Yeah, thank you for the question. I think that those of us living in the US who feel that we have been affected so much by COVID, and we have had to stay home with our children and school and everything, have a hard time understanding really the impact of this in the low and middle income world. So just to give you just a little bit of an image, you know, on one day, maybe 2 months ago, a lot of the countries went into a lockdown. And a lockdown in these countries is not my lockdown when I can go for a run every morning and I have a beautiful house with a great yard. The lockdown was no one is allowed to be in the street. So at that one day, without planning, most government hospitals were transformed into COVID hospitals. All appointments for cancer patients were canceled. Patients were stopped having access to their doctors. They stopped having access to the hospitals. They stopped having access to the tests. They stopped having access to their prescriptions. So immediately we had this moment where, you know, we had thousands of patients calling us desperate. Yes, there's COVID in the world, but all they wanted to know is how can I get the access to my treatment? And so we have had to really come up with all sorts of solutions, ad hoc solutions. And we have had some successes on some innovations. I mean, one of the biggest successes in the first week of this was, you know, in many countries, they don't accept electronic prescriptions. You have to have your piece of paper. You have to go to the doctor. They have to give you the piece of paper. You have to go to the pharmacy. And so it took a moment to convince these physicians and these governments that, yes, you can do electronic prescriptions. Yes, you can do some telemedicine. This is possible. So it has been devastating for patients, for the people living with cancer, to be able to continue their treatment. So, and then in parallel to that, once you solve that issue, then there's the issue of access to information. There was so much misinformation. People, of course, if they're living with cancer, they're very concerned about what's, you know, how is COVID going to affect me particularly. And so creating really good channels of access to good information has been one of the things that I think has been more important in these past few months.
Yeah, absolutely. And, you know, across all these conversations we've been having, it's interesting to me how it's a full spectrum of things we're being dealt with, you know, from really big, you know, prescription and access to treatment issues to things like, you know, in one of my recent conversations, someone who is in Crohn's advocacy, Crohn's and colitis advocacy, said to me, you know, if you're a patient with IBD and your town runs out of toilet paper, what do? And I've never been an advocate in that space, but I've gone through GI radiation from my cancer treatment. And I immediately thought, well, that's something our community needs to know about, because a lot of our patient community in cancer, you know, on treatment or dealing with side effects is dealing with that. So it just strikes me that how, you know, whatever area we're in, there's so much cross learning from all this. Trudie, as someone obviously who understands the cancer experience but works in a different therapeutic area, what are the things that you're seeing because of COVID and how are you responding? And if it's okay too, I see a lot of comments coming up in the chat that I'm excited to read as others are talking. But for anybody in the audience, what are the things too that you're facing and how are you dealing with them? Please contribute them. And Trudie, what is it for you?
Well, a little bit like cancer, a lot of cardiac appointments were cancelled or postponed. And in fact, I know it's the same across the world. 50% of ER visits have been reduced in the US. In the UK, 60% of heart patients and 40% of stroke patients are not going to ER or A&E as we call it. Which means there are more fatalities. And there's a big campaign here in the UK from our National Health Service saying we are still open. But in the panic, people, well, you know, there were cancelled appointments. There's a lot more telemedicine now, which is great. But one of the first things in the very first week back in March, when we were beginning to go into lockdown, I immediately thought, what about patients waiting, or people, because they weren't patients until they get a diagnosis, What about people that are waiting for their EKGs, that are going to get a 12-lead EKG to collect a Holter if services are closing? What about all the people with pacemakers and ICDs that need to go and have them regularly checked? They're more at risk of going to the hospital and contracting coronavirus than they are from staying at home and potentially the risk of dying if their device isn't working. So immediately put my thinking hat on. I phoned the clinicians, you know, what are you doing? What are your plans? And I came up with a suggestion, which they literally, I think if we could have not had social distancing, they would have hugged me. So why can't we collaborate? If I can arrange for the companies to ship direct to the patients at your request, so the doctor gets consent from the patient to either give the contact details to me or direct to the company, whichever they prefer, we will provide the emotional support, the education, the awareness, the information.
Oh, there we go.
All the device companies, and although the majority they only ever ship, they agreed that they would ship direct to patients. I don't know if you can hear me.
Yep.
And so we immediately had being shipped to patients with the results going back to the clinicians, but it's changed the whole way of delivery for patients. And in fact, the equivalent of the FDA, NICE, are now looking at continuing with that. Why do people need to go into hospital if something can be shipped direct to them as long as the results go? So it's ended up saving lives, most importantly, supporting patients, saving money, and a new way of delivering. And it's all, you know, again, I'd say there are three pieces to the jigsaw. There's the clinicians, there are the companies that produce the drugs and the devices, and importantly, the patients. And we need each other. So therefore, we should be working together.
Yeah, very much. Can we go to Pat and then Cary after? So Pat, that example strikes me as being something that might have been impossible to achieve before COVID, but now actually this urgency is creating more opportunity. What are the things that you're seeing where, you know, things previously might not have been possible, but, you know, now all of a sudden there's new ways to solve problems?
Yeah, thanks for the question. I mean, I think that I do always think, I know I was telling you the other day when we talked that, you know, everything we think it's impossible until we make it possible, right? So I think that that has been something that COVID has taught us, that there, in fact, you can do things in a different way. And we have been able to have some great opportunities that I think we're going to stay in the future. You know what? There's just so many examples, but you know, in cancer, when I think about the last mile, I always say in cancer, in the last mile is not bringing the medicine to the patient, but it's bringing the patient to the hospital, because we want patients to be treated in cancer centers that have expertise and know how to treat the patients. Well, COVID has taught us, well, that's not possible right now. So is it really necessary that we have to bring the patients to the hospital? And we are seeing all sorts of innovation in terms of decentralization, where there's coordination with clinics at villages and small cities. And we have all sorts of ways in which we are now coordinating and bringing the medicine to these smaller villages, and the patient can go there and be seen by a physician and pick up. And we've had examples of firefighters delivering medicine. We have examples of the police, because these are the only people that are able to be in the street. We have examples of drones delivering medicine to the villages. And so that it is showing us that it is indeed possible to decentralize without losing that, that expertise. So, you know, we're walking carefully into this area, making sure that the standard of care is still maintained and that patients are well treated for their disease. But I do think that, you know, I hope that everything about, like Trudie was saying, home delivery of medicines. I think that the whole issue of the prescriptions and the telemedicine, I really do hope that that stays for the future.
Dave, perhaps I can just build on that. I think that as a community, we need to look at COVID. Obviously, it's something which is desperately sad, and there are a lot of people losing their lives through it. But as you see, there are some silver linings underneath that dark cloud, and it's forcing innovation. It's forcing some, you know, some thinking that's been in place for a long time to be questioned. Things about, like, you know, how we get drugs to individuals now, how do we redesign the processes of supporting people with particular diseases. And so I think there are two dimensions. The first one is we have almost a responsibility as a community to share these ideas, these solutions which are emerging from this crisis around the community as COVID takes hold in different countries at different times. I'm a bit shocked about how we haven't transferred knowledge of dealing with it as it's gone around the world. And I'm looking at, for example, in Brazil at the moment, and I'm fearful about what will happen in that country. And there's so much that could have been done off the back of what happened in Asia and what happened in Italy and what's happened in the UK, etc. So I think as a community, there is a short to medium term objective for UICC and other organizations like that to understand what is working, where the ideas are coming from, and share them quickly, rapidly, so we don't make the same mistakes twice and that a good idea gets around quickly. The second thing which I think we have to do is we have to capture the implications on cancer treatment and care and patients in a way which allows us to be better prepared for the next COVID. Now, whether that's going to be in 2 years' time or 3 years' time, I don't know when it's going to be. I'd hate to feel that we were having this same discussion there in 2-3 years' time, saying, oh, we're trying to cope by doing this. We should formulate exactly the best way to react to this, and how should cancer patients deal with the next pandemic, and what is the health system response, and how do we educate the health workers to avoid COVID, and how they should be protected, for example, and how do we segregate cancer treatment from COVID treatment, and a whole series of things which I think we're learning as we're going from. And some people are documenting it really well, and we should distribute that now. But I think there's a long-term thought process that we need to say, one, how does health systems change to become more pandemic ready? And then secondly, how do we make sure that being pandemic ready means pandemic and the other disease ready? It's not just the pandemic ready, because we've heard, you know, it is impacting people with underlying chronic conditions. It's impacting the treatment of cancer patients around the world. I'm hopeful that, you know, we will learn from that process for the second stage. But there is certainly I think there's an onus on the likes of my organization to capture that and then share it and then get prepared for the next challenge. I would say there's one other thing, which is, again, is something we need to learn really quickly and well, and that's where UICC has joined up with a cancer and COVID-19 task force of eminent researchers and who are looking at understanding, really trying to understand the link between cancer and COVID, you know, and what is the link, and how much is there an increased danger of potentially dying of COVID, and what diseases within cancer, because there's many, are actually more at risk than others, so that we're wiser for the next one. And so I think this is the sort of work that we have to do collaboratively around the world. No one can do it on their own. It's impossible. This disease is affecting different countries, different groups, different segments of society in different ways. But we do need to pull together to understand that longer term planning.
Yeah, completely. And remarkable is not just the size of these issues individually, but how many issues are at play here. I see Liam and Oriana in the chat, you know, talking about the interruptions to clinical trials. and not just what that means to patients today who are trying to access new treatments, but to what that means in the next couple of years for the launch of new treatments. And there are just so many ripple effects that we have to really be sharing and collaborating to address. I know that I think 2 weeks, so this coming Thursday is a session around virtual conferences, best practices, and then the following week will be around the interruptions to clinical trials and how we deal with that. And then I know after that we're dealing with telemedicine, and how much this COVID has really forced us to consider things that were challenging to adopt before. So, Cary, I share your view completely. There are opportunities in these things that we can really help move forward. So, if we could take just 1 minute each, and I forget which one, maybe it was Cary in the opening, but I know in our prep session we talked about, as leaders, oftentimes the hardest things to talk about are the most important, right? The easy things we can be more open about, but when dealing with really challenging or complex or embarrassing or provocative topics, leadership and advocacy is about leaning in. And I know that affects the brands that we're building and the missions that we're leading. Cary, I think let's go Cary and then Pat and Trudie. And if you could spend just 1 minute, if there's been an area that was really something you had to lean into, I'm sure the audience would love to hear that.
I wish it could only take 1 minute, Dave. I could spend 2 hours, 3 days or 5 weeks, or run a master course over a year on that. But
we'll have you back for more.
Go for the minute,
we'll have you back for more.
Okay. I think, one of the things I'm very proud of with UIC and our collaborations over the last few years is we've actually created 4 different organizations and we've spun them off, okay? And each one of those organizations was set up, established because there was a really big problem that could only be solved through collaboration. Now, whether that was the global NCD problem that wasn't recognized at the UN, that didn't really have the global commitment to it, and creating the NCD Alliance, which was one, where it's about seeing that there was a problem in governments around the world that didn't have the legal resources to put in place the laws on tobacco control. Because normally it's one lawyer in the government trying to do everything, and they were beaten up by the tobacco industry and all of the lawyers they could employ in that country. And so let's create an army of lawyers, government lawyers around the world, and train them up and create a community of help so that they can each more quickly and more effectively put laws in place to address the risk factors of cancer and NCDs. Or if it was creating an opportunity in cities around the world where we could see that we could address cancer city by city around the world and create a foundation called the City Cancer Challenge Foundation, which we're really proud of. Each of those was really hard to establish because we had to reach out to different groups and convince them that this was the right thing for all of us, and therefore collective action would lead to long-term impact, and individual action would not achieve what we were all trying to achieve. And therefore we had to throw away our brands. We had to think about the collective action. We had to give and take a bit and pull together organizations which now are performing wonderfully and doing a brilliant job for the health community. But it was really hard and had its bumps along the way to getting them established so that they can have the impact that they really can have. But that's more than a minute, Dave, and I apologize, but I could talk at length about each one of those and the challenges that we faced in getting groups of organizations together to do it, getting groups of organizations to fund them, okay? And everyone be prepared to put their brands aside and be proud of the collective response that we put together. Really hard work, but certainly worth it.
Yeah, be proud of the collective response, Cary. That really resonates. May I know I said we were going to switch to Pat next. I see a comment from Melanie. And so, Trudie, may we just connect with what Melanie's saying? I see that she's in the same space as you are and have had the privilege of working with you, over many years on different collaborations and things. Can you build on that? And I'm eager to hear what Melanie's chatting about.
Yeah, the whole ethos in everything I do is about collaboration, because no one person or no one organization can achieve everything. So I've been going 27 years when I came across Melanie and other organizations like Melanie. immediately reaching out, what can we do to lose our identification? Because lots of people, they've all worked hard to be where they are. So it's important that we maintain our identification, but we'll all move forward with the same aims and objectives. And if you work together, you have a louder voice. So when Arrhythmia services in the UK were really poor, my little charity at that time could not have brought about change. But by reaching out to other organisations representing other arrhythmias, we all came together. Yes, this was from my dining room, and then I moved into my garage, that sort of real, home feel, but I coordinated it. And then that's how Arrhythmia Alliance came about. And that's why we're in so many countries worldwide. Doesn't mean to say I'm physically in that country or my immediate staff, other organisations. And so it's so important. And Melanie and I have worked on so many research, whether it's patient inquiries, whether any of these different things. It's so that it's not just one voice being heard, but several voices being heard with the same or very similar messages. And collaboration is key. Whether you look at that within your family, a family that works together, stays together, gets stronger, or whether you look at that, if you're in the bank, two of us have worked in the bank, whatever profession you're in, you need a team of people, and non-profits are no different. We need a team. We need to work. And, whether you're diagnosed with a cancer or an arrhythmia, or with Melanie and I, we focus on atrial fibrillation, the most common arrhythmia. Just because you live in America or England or Brazil or Bangladesh, you experience exactly the same thing. But how you access treatment for that is totally different depending on which country you live in. Whereas if we work together to strive to get the best possible outcomes, to improve the patient outcomes, to improve their quality of life and restore that patient back to a person. And we can only do that by working together. And I am passionate about collaboration.
And I feel how passionate you are. I wrote down, when we work together, we have a louder voice. And that's what this to me is all about, is how we come together to have a louder voice. And for anybody in the audience that hasn't been on a panel yet or had your voice heard, we want that to be a part of that. And so, this will go for at least the next 3 months, and we want everybody to have a chance to have their voice heard and then work on elevating these together. Really powerful, Trudie. Pat, if I may admit, I've looked up to the Max Foundation my full 8 years in advocacy. And I have to admit, I'm personally, as much as professionally, really eager to hear what those tough issues are that you've faced and how you lean into some of those as a leader.
Yeah, thank you for the question. I have to say, I do want to focus on COVID-19 and the impact on each of our organizations, and how do we sort of come out of that with the new normal that we have right now. I have struggled in the past 3 months to figure out, first of all, it stopped us in our tracks. All the plans we had at an organizational level with our brand for communications, for fundraising, everything in one day was no longer sort of what we needed to do. So I related to what Cary said of having to sort of reinvent yourself and figure out how to move forward. Figure out how do we coexist with COVID-19. I mean, for a moment, it felt like the first few weeks, it made no sense to put out any news about what we were doing if it didn't have anything to do with COVID-19. So it took a moment for all of us to figure out, how do we now integrate the world of advocacy that we are doing with cancer with COVID-19. And at the same time, we all moved very quickly to working from home. I feel that for ourselves, we were lucky in a way that COVID-19 hit the US before it hit the countries where we implement our programs. And it hit Seattle first, this was the first case in the US, was right here. So we moved quickly to a virtual world and be able to adapt. But, we live in a world where every single one person in the world is in crisis right now. You're worried about your family members, you're worried about yourself, you're worried about your children, you're worried about jobs. Yet we still have all these plans and we still have all these goals that we want to achieve. And every day as a leader, I struggle because I see my team so tired. And 3 months into the thing, no one is taking a day off because you're not going anywhere, so you don't taking anywhere. So I do every day try to balance that. Should we still try to achieve everything that we wanted to achieve? Do we consider that now we're all in crisis, and COVID-19 occupies a big space in all of our brains, in all of our daily lives? And so how do we make space for that? So I do, and then as we are, I feel we're still at the beginning of this, right? So we still have a long ways to go. How do we pace ourselves? How do we start seeing the future? I think I have struggled. I'm proud of myself that I typically can see 2 years from now what we need to do so that we can prepare for that. It has been difficult to figure out what is the world going to look like 2 years from now. What are those opportunities that we should see today that we need to start working towards? And those are the challenges. On the opportunity side, I do think, we look up to UICC. We're a very committed member of UICC, and all of our patient organizations are thankfully also members of UICC. So I do think that we need to start building the collective voice. And we need to even cross field, start figuring out. I'm sure that we have many things in common with Trudie and the work that she's doing. So how do we find those areas of building more coalitions even than before?
Yeah, I know it's powerful, Pat. I know the audience who's watching us now and people who will watch this later only see on camera the person who's talking, but I wish you all could see everybody on the panel like we can, because I see so many heads nodding, about the need for collaboration. And I'm really grateful, I think, how much this moment has given us a chance to be human as leaders. I'll share that when COVID started to get really intense and all the uncertainty that meant for our organization, I had to, or thought I had to, make decisions abruptly and quickly. And I do think those were needed, but what I learned from that is that my decisions can never be as strong as the team that we make decisions with. And so that was a really humbling moment for me, to not try to lead alone, but to really listen to the people on our team that I trust and that are so passionate about the work. And so I think we're all learning, not just as organizations, but as leaders and advocates. And just listening to your remarks really make me grateful that we get to be that human and that authentic. So thank you. I shudder, Cary, to ask the last question, because I was originally going to ask it with giving each person only a minute or two. And I've learned that's something that I should not go back to.
Give me 3.
So how about in 3 minutes each? What advice would you give to other advocacy organizations, or for advocates who are starting out? What are the things that you've learned that you can share with them?
If you're talking about more generally in terms of advocacy, my advocacy space is working with the UN, working with the World Health Organization, working with the member states and missions in Geneva. I would say that what I've learned is something which actually Trudie said earlier. If you have to feel passionate about something, and you've got to be passionate about making it happen. That's the first thing. I don't see many great advocates who aren't passionate. So that's the first thing. You've got to believe it in your heart. The second thing is you've got to be wise, and you've got to be clever, and you've got to set out exactly how you're going to achieve that over a certain period of time, and who are the people you need to influence in order to make that thing happen. And that will not happen on your own. Rather, like, leadership is not a standalone event. My team and I, we work closely all the time. We discuss everything. My board discuss things. You've got to get a collegiate understanding of the space that you want to operate in, who are the right people to talk to, how do you bring other people in, how you're sensitive to the concerns of others in the global space on advocacy. Because at the moment, we're being sensitive to the COVID issue. We're not pushing cancer advocacy as much as we have done in the past, because we recognize this is a very important issue that needs to be addressed. So we're allowing that to be the center of discussion at the World Health Organization. It should be, but we're still keeping an eye on what we want to achieve in cancer. So, for example, we campaigned for 2-3 years to get a resolution on cervical cancer, that we could eliminate that in this century. We could eliminate the cancer, believe it or not. Now, that's gone through the World Health Assembly, but we're not pushing it too hard at the moment. We'll wait until we've got past that COVID issue, because that deserves center, and then we'll move on to cervical cancer, and we'll start promoting and pushing it very hard next year. So I think there's a number of things. 1, passion. Second thing, be clear about what you want. 3, understand the landscape you're operating in. Engage the right people. Show empathy, be sensitive, be wise and clever, but pursue your ambition to the end. Okay, it's not over the line till it's over the line. Okay, so it's easy to be put off when you're trying to achieve something in advocacy. So I think those are the components that I'm looking for, and they apply today as much as they did 6 months ago, and they'll probably apply in 6 months' time as well. The key principles of getting change to happen to the benefit of society are the same. Okay, passionate advocates, well-informed, articulate, with empathy.
Yeah. Empathy and passion with planning, loud and clear, right? We have to know where we're headed. I love it. Trudie, what advice would you share with someone?
Don't just identify the problem, always offer a solution as well. Something that I learned very early, this isn't a battle, this isn't a war, this is about working together and going through the treacle to try and find the solution. Work with others, listen to others, but definitely I always remember the National Clinical Director for Heart Disease in the UK said that he was willing to work because I offered solutions, as opposed to just banging on a table saying, you should do this, you should do that, why aren't you? And I think you go a long way if you collaborate, you allow everyone to have their opinion and then bring it together with a solution.
I remember someone said to me early in my career, don't just admire the problem, focus on how to solving it. I love that advice. And Pat, closing words for you. What advice would you share?
Yeah, thanks. I'll add to what Cary and Trudie said. To me, the advice I give is tell your story, keep telling your story. Maybe you asked for help for 10 people and they didn't listen, but it's that 11th person that is going to listen, because somehow your story is coming at the right time for that individual to be able to help you. So on one side, never give up. Continue to advocate to anyone that will listen. And on the other hand, have data. I think that smart advocates, collect data of the patients they represent. So, I have a lot of people advocating to me typically for help, patients, patient organizations, but are those that never give up and keep telling their story, and the ones that on top of that send me data. I remember in the early days, I had this person that ended up being a dear friend of mine in Venezuela. And she had, not only she was telling me, we're dying, we don't have treatment, we need treatment, but here is a spreadsheet with a list of 168 of my members with their names and their age and all the information about them. And that made it so much more powerful for us to be able to help. So, I say never quit. And like Cary said, try to be smart, try to be wise every day, and never stop asking for help.
Yeah, wise advice. And it's humbling for me to hear this. And, for me early on, I felt like I was doing this a lot alone or not knowing what to do. And I think the more we come together, the more I just feel empowered and centered and really grateful for everybody's work together. So I want to wrap up by saying thank you to our panelists today, Pat, Trudie, and Cary. Thank you so much for being with us, for all the work that you're doing in your organizations, and for being a part of this advocacy exchange. Next week's Thursday session will be about how we do virtual events really meaningfully, not just to disseminate information, but also really to have the connection and closeness that we all crave and aren't getting. So really grateful for that. And for everybody in the audience, once this closes in just a few seconds, feel free to visit the exhibitor booths to check out any of the resources that have been set up there. It's open 24/7 and it will be for the next few months. So really grateful for this time together, excited to see what we all build, everybody with all of our organizations, and to not just get through COVID, but to become better because of it. Thank you, everyone.